name is Murai Mazo. I'm going to do a presentation about health promotion models. What are health promotion models? These are ways of evaluating the effectiveness of health programs. I'm going to explain on these models. Number one, health belief model. What is a health belief model? This is a people's perspective towards health issues. What people believe, what they think is normal, what they think it's acknowledged. So that's the belief of people towards the their health and health in terms of the nation. Probably it can be a pandemic disease. What are people thinking about isolation? What are people thinking about implying the government's rules towards the pandemic or towards the certain issue about health? Number two, we have trans-theoretical model. Trans-theoretical models, these are in stages. It is a belief that mainly focus of an individuals, and it is in stages. The first stage is pre-contemplation. On pre-contemplation, that's when the person is not doing anything change or not even thinking about changing, just living, not deciding. There's nothing, completely just living and doing whatever he or she is doing. Then contemplation, that's when someone is thinking of changing or not to change, deciding to change or not to change. Then preparation, that's the stage when someone is starting to prepare to change. And action, that's when the person is actually working out on making him or herself to change into action. Maintenance, after changing, you do action and you changed via someone new, probably maybe you're on medication of something, or then you maintain, you adhere to maintenance, you adhere to medication, you adhere to the idea of accepting the change that you did and try to maintain that change. Number two, then another model is social cognitive theory. What is social cognitive theory? This is a model which has to do with the environment. What people think in the environment that may help you in terms of health education or implementation of health in yourself towards the society, towards the environment. We have health promotion model, a health behavior. We are talking of what a person is doing to make his or her health better. For example, to eat a well-balanced diet food, to say no to smoking, alcohol, try maybe running every day, doing activities, something that makes someone healthier. Then the fifth one, ecological model, it has to do with ecology. Then we are talking of how the organizations like NHS is doing towards people's health, how the government itself is cooperating, how are they implementing their ideas and the situation towards the health perspective. I want to compare two models among these models. The one that I want to compare is health belief model and trans-theoretical models. On focus, health belief model, it is focuses on people's beliefs, people's perspective towards what they think about, what the knowledge they have towards a certain situation. And the trans-theoretical, this one, it focuses on stages. Are you changing? Are you not changing? Are you doing action? Are you preparing? That's trans-theoretical. Then action, this one, it involves individual to take action. You believe that isolation is important, so you have to act so that you can protect the environment. You believe that we need to be vaccinated. What are you doing? The action that you are doing that promotes healthier environment or health you. Then trans-theoretical, this one, it involves in stages, having action in stages. Are you on pre-contemplation or contemplation? Is it that you are preparing to change? Are you doing something, or are you maintaining what you have changed? Then approach, this one, health belief model, it's based on belief, what you believe, and this one is based on stages, changing stages. Knowledge, if you have a positive an idea, positive minds towards the change, towards the promotion of health, it is you need knowledge to understand. You need knowledge to know what you have to do, and also what motivates people to go through these stages is knowledge. So knowledge is very important in both sides. Once you know why is it important to stop smoking, you started to do the stages, having knowledge of the advantages of living a certain type of thing. It might be alcohol. Now I want to evaluate how effective are these health models. They are very effective. They help much in health sector. Health belief model, yeah, it is easy to understand. You understand what you believe, and the weakness is once you have a negative belief towards health sector, it is very difficult to implement and to make use of it. Number 2, we have social cognitive theory. This one, it has got an advantage that it involves the environment. It involves others. You might get reinforcement from others, which makes it easy to implement, as it is not only your idea. You might be motivated by other people's. And the weakness is it is very, very dangerous when it comes to peer pressure, a negative peer pressure, or in a toxic environment, as it involves others. They may cause even more danger or a negative attitude, while we are trying to reinforce for a positive attitude. Another evaluation is on trans-theoretical model. What is the advantages? It is good because it gives people time. You may stretch, and it helps you to know exactly where the stages you are. For example, maybe you are just preparing. You know that I'm in a stage of preparing. I have to do something in order to reach the action stage. So, and it is also evaluating when you're doing a program of trying to help people. You can evaluate which stages are we on. Are we progressing or not? So it's a good way of promoting a health environment. Then the weakness, it doesn't involve reinforcement from others, as it involves individuals. You usually, it's you who should think of changing and make yourself active in those ideas. Then we also have a health promotion model, the healthier issue. Like, it is an advantage because it involves eating. We all like to eat. So if you know what to eat, I think it's good. It's good to exercise. Sometimes you can just do these things to entertain yourself, but gaining a model. Then the disadvantage, it might be a challenging, especially in poor countries where promoting a well-balanced diet meal can be difficult. And then these models, they are really important. What is needed to be used is to see where exactly to use each, because some are very effective in certain some of situation. For example, like the health promotion medal, it is good when we get that food, when we can, try to make people run. So all are important, and sometimes it's good to see the most effective in the situation. We also have what we call a health promotion initiative. This is when we are trying to initiate certain type of programs. We are putting programs in people's lives that motivates them, that allows them to make a change. For example, there's what we call Dry January. When people try to encourage people to be dry in terms of alcohol, not to take alcohol. This is a motivational way of trying to help people to leave some things that may damage their lives. We also have another one like Stoptober, where we say let's stop smoking. Usually it's done every year for 28 days in the month of October. I'm going to explain particular on Stoptober. What are the aims of Stopover and what are the objectives? By the end of the program, what actually are we supposed to do, should be done in order to implement it in a positive way? Mm-hmm. So the purpose of Stoptober is to reduce or to end smoking, so that we can promote health perspective, we can promote health individuals, we can promote a health environment by stopping smoking. So the main aim is to make people quit or stop or not to smoke. That's the main. So by doing this, we have we are trying to promote a healthy environment, and we have objectives that we should do in order to promote that Stoptober to be useful. So people should attempt to quit by the end of the program. We are trying so that people should quit smoking, and actually by saying no to smoke, we can share advices. People can give their testimony, like those people maybe who quitted some time back. They can give people testimony. They can give those who are knowledgeable can share the advantages and the disadvantages of smoking on those programs. According to statistics, this Stoptober is very effective in terms of changing people. It is helpful because it have a positive results, and people, it is showing a change in people's lives. It is showing a positive change, where people are changing, where people are trying to quit, where people they are attempt, and some of them are quitting smoking, which is good. For example, it is written that about 25% of smokers were attempted to quit in 2019, and among those 25%, about 9% of them, they were found still on quit after a month. And in the year 2020, there is also 19% smokers who quit in England, and on those 19, 8% of them, they were found still quitting in week 4, which is a very good a program which is showing a positive results. and they are aiming to keep doing that to end smoking. So Liz also mentioned that by 2020 the campaign generated quit attempts among 12.3 of all smokers, and recently ex-smokers with 4% reporting that they were still not smoking. There are some people who had quit completely, so it is very, very useful. So we are saying that quitting, the strength about this program is showing that quitting smoking, it gives people energy, it helps people to become better, to become healthier. Their voices, their energy, the way they breathe makes a great change in their lives. And the weakness about this program, we need money, so it is also pumping out the government's financial money to promote this campaign, and not everyone is attempting to do that. We are trying to help by doing this program, but some people, they're just ignoring the program. The contribution of NHS as an organization is contributing much in the government for having better health model, better health people, improving illness outcomes. People are treated, they're getting better, they try to follow up. They employed nurses, doctors, radiographers, many specialists in order to help people. But there are some weakness, like it might take sometimes people to get treated. Appointments dates may become longer, maybe a month or so. Then we have supporting people with risk factors. As NHS, they try to make use of rehab, helping people to support them to avoid those risk issues like smoking, taking drugs, and then free treatment. They are also contributing a very good thing, because their treatment is at zero cost, which helps everyone, which motivates everyone to go to clinics, to book for appointment, and they can also offer treatment at home, treatment at your own comfort zone, which is a very good way of promoting a healthy environment. And also implication of policies to clinicians. NHS is doing quite well, good things. They make sure their policies are implemented, such as safeguarding. They make sure they try to follow the patient's charter. Thank you very much for listening. If you want to start more, you can check on this reference. Thank you.